your name?
Aaron.
Aaron. Who's this?
This is Tosca.
Tosca. Okay. Can you just explain what's happened?
Mate, I was upstairs at the house and I heard the dogs barking, and when I got out there, he was in the corner and my dogs attacked him.
12-year-old Tosca is in trouble after a backyard brawl with one of his canine housemates.
You didn't see him being shaken or...?
No, I didn't see anything. By the time I got off there, my dog was off him.
They ever fought before?
No, he's always growling at him and having goes at him, but he's always backing off. He's never done it before, no.
Okay. Yeah, can we get some oxygen?
Yep.
Just getting away today, did you, Tosca? Somebody. This kid calm there, mate.
It's a nightmare family feud. The injured Tosca belongs to Aaron's girlfriend.
She's going to kill me.
What, the missus? Hint of a bit of hemorrhage in the corner of that eye too. So it may have been where he was shaken. The biggest worry with these dogfight injuries is essentially that it's not just the actual impact of the bite, it's more the shaking and the twisting that occurs after that. It's sort of like a whiplash situation where one part of the body goes in one direction, the other part goes the other. And what's left in the middle is stretched, is broken, is torn. And if that's the spinal cord, then we have big problems.
Oh. I just hope he's all right, like.
Come on, let's go.
You just can see that she hops more than separates and runs, you know, and you can just sort of see that she's in a bit of pain.
Just come on, come here.
Brooklyn is just a year old, but she's already battling debilitating arthritis in her hips and back legs.
She struggles with stairs, even just in and out of the car. There's a bit of a struggle.
She can't get into the car.
Yeah.
And then when she gets out, she kind of waits, like, for you to kind of give her a little bit of support.
Go on, get in there.
The only reason she can move around now is daily painkillers.
She looks like she's a 90-year-old woman. Look at that. She's got no strength there.
Ollie and Sasha have arranged to meet up with their friend, emergency vet Lisa Chimes, for advice.
My concern is that Brooklyn's got something called hip dysplasia, so it's a genetic problem. They're born with it. It is so much worse than you described. Honestly, I'm shocked. A hip should be a ball and socket, and in Brooklyn's case, I fear that her socket is underdeveloped, so the ball doesn't sit in the socket, it slips out every time she walks. It's not a curable disease, so we have to do pretty drastic surgeries to fix it.
Okay, come on. Yeah.
So what we need to do now is get Brooklyn over to Sash, get the surgeons to have a look at her and take some x-rays to see exactly what's going on. My worry is that there's going to come a time, which is going to be pretty soon, where she's going to be so crippled that she won't even be able to get up.
If we just feel around here... Yeah, okay. Sorry, mate. It's all right. Okay, so he certainly does have some neck pain there. Whether it's just soft tissue damage, just bruising to the muscles around there, or whether it's more serious, we'll find out in a second these x-rays.
Aaron is stressed. His girlfriend's dog Tosca is now being checked for spinal injuries after a fight with his bull terrier.
The quietest I've ever seen him.
The concern I've got is this area here, from C1 to C2. So there's just a bit of a step there. It's certainly not severed, but it's an area of concern I'll just flag now, because if there are any issues later on, then that's probably where it's going to be coming from. Okay? Okay, so we'll move him through. Aaron's living out a nightmare right now. This is a fight within his own family of dogs. Inside, he must just be going through the worst of emotional turmoil. Did you want to call?
Yeah, I'm going to have to.
How'd you go?
She's pretty cranky.
Probably not the news she wanted to hear.
No. She's another Tosca. She's only a little girl, but she goes for the throat and growls and bites, and she's a pretty scary woman herself.
Little Tosca's still in a lot of shock, but his anxiety levels are nothing compared to Erin's. I've never seen a man so scared.
I think if anything had happened to him, she would have left me.
You're not joking, are you?
No, I'm not. No, I would have been scooted out the door, quick smart.
This might just sting a little bit.
Tosca has survived an attack by his canine housemate with no major injuries. But there's still a problem. The terrier is the beloved pet of Erin's girlfriend. She's furious because it was Erin's dog who attacked little Tosca.
So incredibly lucky.
I won't be feeling very lucky when your mum gets home.
You reckon this might be mild compared to what you're going to cop?
I reckon you should see the lacerations I'm going to end up with. Getting us both in trouble now, you know?
The question now is, what will happen when Tosca returns home?
Tosca's got the first bite in. Now that changes things. What we have here is a big struggle for dominance and a struggle that could be fatal unless we can sort it out.
Tosca now needs to rest and recover from his shock, while Erin goes home to face the music.
I've heard so much about this woman. I've got to say, I can't wait to meet her.
Yeah, she's certainly very under-muscled.
Ollie and Sasha have brought Brooklyn in to see specialist surgeon Andrew Marchevsky.
Okay, you're all right. Good girl.
The French Mastiff is only a year old, but already crippled with painful arthritis in her hips and back legs.
So this is her hip joint, right? So it's a ball and socket joint. And what her hip at the moment is, it's sitting out there. And every time she walks, it's just crunching against the edge. And she's getting lots of arthritis from that. So from what you're telling me and looking at her x-rays, I think a hip replacement will make a huge difference to her.
For such a young dog, a total hip replacement is a major operation.
If we do nothing, she might be able to live for a few years, but it might be only 4 or 5 rather than 8 or 9 or 10. So I think it's also quality of life and quantity of life.
It's better to know now. I think we've tried to kid ourselves for a while, just going, oh, it's not that bad.
It's not good that she's just constantly rubbing bone on bone when she walks. She hides it well.
It's expensive, it's invasive, and there is the potential for things to go wrong. All right, come on, you with me.
Brooklyn will be the first hip replacement ever performed at SASH. Everybody has a lot at stake.
I do feel almost a sense of fear and you know, a sense of responsibility that if something does go wrong, and I've kind of pushed them to be proactive about it. You know, it's not risk-free, and we just have to keep our fingers crossed that she's in the successful group.
You don't tickle her head in the right spot, she lets you know.
Back at the Bondi Clinic, a new patient has arrived for Chris, a pet cockatiel called Cheeky.
We go almost everywhere together. Shower, shops, bike riding, car, bank. Yep.
Do you both want to come through? Who do I ask, Cheeky or you, Brennan?
Both.
Both, okay.
I've noticed some drops of blood today on the bathroom floor, so she is bleeding, not from her feet, I think from her genitals, so I was really quite worried about that.
Oh.
You sort of just have to tell her, not ask her. That's
Oh, really?
Yeah.
Gotta be firm.
Yeah.
She's a strong woman.
She is. So if you just tell her what you want to do, she'll do it.
She likes assertive men.
She does.
It's always been a problem. Come on. Now, Cheeky, no. Yeah, you're gonna get up there. Thank you. It's the way you go. It's how you treat a woman. So I guess a few drops of blood doesn't sound like much, but in a bird, that's...
Quite a bit.
Yeah, quite a bit. Okay. So I just want to have a good look at her. There is a little bit of blood around here. What's this going on?
Oh my God, what is that?
What's this going on?
Wow, oh my God, what is that?
Chris has found the source of Cheeky's dangerous bleeding.
At the base of that gap is a hole,
Yes.
and that's where that blood's coming from.
Yes.
So I think she's actually lost a feather.
Sweet lamb.
What we'll do is just clean it up with some antiseptic and just try and clean around the base of where that feather's come out. So I guess we need to work out how she's done this, because the worry is that if she does this when you're not around or when you're asleep and she actually has a decent bleed, she can actually get into quite serious trouble. So has she been doing anything abnormal behaviour-wise?
She...
What Prem's struggling to say is that the naughty Cheeky spends too much time self-pleasuring.
How often?
She does it every day.
Yeah. For how long?
Sometimes a lot every day. Sometimes for 15 minutes.
15 minutes.
Yeah.
Cheeky is so incredibly sexually frustrated, so wound up, that not only is she pleasuring herself, she's gone to the next step. She's pulling her own feathers out. What does she do it against?
There's a part of the twig that she always kind of backs up against. She stands on one leg to get like right in the right position. It's really funny. She'll like lower herself right down on one leg.
I think that comes under the title of a little bit too much information. Cheeky, get on the hand.
That's it.
So what is the solution to stop Cheeky's harmful habit?
She's doing that right now because the weather's just warmed up.
Yeah.
And because of that, she has all this energy, but also all these messages in her body saying, you must mate, you must breed. But there's nothing around her that she can mate with.
Yeah.
So what she needs to do to lower that sexual frustration is to convince Cheeky that it's actually not springtime. And the way you do that is actually lessen the daylight hours. Put Cheeky to bed in a darkened room at 5 o'clock in the afternoon. So Cheeky, sounds like you're gonna get the treatment you deserve. Early to bed like all bad girls. There you go. See you, Cheeky.
I'm getting nervous now.
The surgical team is preparing for Brooklyn's hip replacement.
So my incision's here.
Yeah, it's a little tense. Absolutely. There's a lot to gain and there's a bit to lose. And I think because this is Sash's first one, it's exciting. First incision.
This is major surgery for a 1-year-old dog.
It's a ball and socket joint we're replacing, and the cup is the socket part of that joint.
Okay, and you'll be able to tell me if I'm getting in. Ready?
In human terms, it would be the same as a complete hip replacement for a 14-year-old.
We're putting a metal rod down the middle of the thigh bone that's then going to attach to part of the ball and socket joint to make up the hip. So we'll push it down and just hammer it in and it'll stay there. The biggest problem with this part of the procedure is us actually splitting the bone. And if we do that, that's a major problem. Try that.
Yes. Position looks good.
Overall, I think it went well.
Nice. It's perfect canal fill.
We had a few hiccups. This is our first one, and I sort of half expected it wasn't going to go perfectly. It was a little frustrating.
The biggest threat now is an infection setting in around the implants. It will be 2 months before Andrew can tell if Brooklyn will make a complete recovery.
It is high stress because the implants themselves, they're $2,500 worth of just the implants. It's high stakes.
Erin's much talked about girlfriend Christine has finally arrived at the clinic, and so far he's still in one piece.
Oh. Hey. Oh. You're all right, baby. Oh, I'm so sorry. Baby. Love you so much.
Well, he looks a lot happier happier than he did this morning.
He doesn't look happy at all. Look at him. He's like going, oh my God, I just want to fall asleep standing here. He's not happy at all. He's just kind of... I think
he's happier than he did when it happened. He didn't look too happy then.
I'm going through like feeling really upset to feeling grateful to feeling kind of like, oh, you little bugger, what have you done? Sorry, excuse my French. But like, I'm just going through a whole bunch of different emotions because I'm so happy that he's alive.
It'll be a good night for you then, Erin. It'll be a really good night for you. I thought one fight was enough for today. To have two presented to me, don't think I could have handled that. So to see Erin and Christine getting along for now was nice. So I thought that was going to be the most challenging case of the day. You guys rather than this one.
I've learned out when her left hook's coming now. So.
She signals it, doesn't
she? Yeah, she's got this little twitch in her eye.
It's pretty clear that Tosca means everything to Christine. Erin has dodged a bullet today. If this was more serious, he would have been facing a lot more serious punishment, I'm sure.
The family must wait for Tosca to fully recover before he can head home.
I'll be thinking about you tonight, all right?
A bit apprehensive, huh? Not too sure about this, are you?
Hey,
hello.
Tosca.
Hey, buddy. Look who's home.
Welcome home.
Chris has brought Tosca back to the scene of the crime.
Is he all right?
Hey, little man.
But can he and housemate Frankie sort out their differences?
Come here.
Frankie, you got visitors?
Come here. Who's this?
Oh, he gives him a sniff.
Come over here, Frank.
Frankie.
Come here. Frank, come
Frank.
here. Oi. Right. Get out there. Get out there.
I'm nervous. I'm nervous to see her. I'm just worried that she's in pain or that she's not really sure what's going on.
There you go, darling. It's all right.
The next day, Ollie and Sasha visit the hospital's very first hip replacement patient.
Brooklyn is doing really well. 24 hours post-op, she's using the leg. She's tentative on it, but she doesn't have any major problems. Who's that? Hello, darling. You're a good girl. Sasha looked a little gobsmacked. I don't think she realised exactly what was going to happen. I think she saw the size of the incision and was a bit, oh. All right, sweet, come on then. We'll get you back.
One more week and Brooklyn will be ready to go home.
If she were a human, she'd still be in bed, or if she wasn't in bed, she'd be on crutches and really hobbling in a hell of a lot of pain. I'd see my father-in-law go through it, and she's doing much better. Good girl.
You've got to battle for supremacy when there can be only one captain of this team. It has to be Frankie.
Frankie has been let out and given a second chance.
All right. Woo.
Chris believes he has the solution to this sibling stoush.
He still is entire, still hasn't had his balls removed.
Yeah.
Now,
would that be a good thing to do?
that would certainly help.
You reckon?
Yeah.
Okay.
But what I can give him in the meantime is an injection to block the effects of testosterone in his brain. So stop him from being the big guy in the small body. All right. So it's not going to seem like much, but 1 mil of this drug here should change his whole attitude.
Okay.
So in a way, what we're doing is chemically castrating him.
Okay.
Just lucky this didn't happen to you yesterday, Erin.
Yes.
Could have been you getting the injection.
Well, you've got more than $1 million there, don't you? No? No?
Oh.
Steady, Tiger.
Fix you while you're here. The fact is, once we remove that testosterone that's really revving Tosca up, then he's going to pull back. He's going to be more relaxed. He's going to acknowledge that Frankie is the boss. Once there's stability there, Christine and Erin have their happy family back together. There's a lot of love there. We've just got to make it work. And this will make it work.
Better? Oh, yes. I love you too. I do. I love you too. You happy to be home?
Good luck, guys.
Thank you.
Thanks very much, Erin.
Thank you so much for everything.
Pleasure. No more growling. Talk to you, Krista.
Yeah. No more.
Come on, you want to stick? 2 months later, and it's a great result for Brooklyn as she runs and plays pain-free.
She's just never tired and never sore. It's really, really amazing.
Oh, she feels so much more developed in her muscles and she just looks great.
You see her now and then you realise how bad it actually was for her, yeah. Definitely stoked we did that, you know.
She is our first hip replacement and it's successful and everybody's happy, so it's something that the surgeons can be really proud of.
Hi, I'm Dr. Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.